We want to start off with a reminder that we are not doctors. Before you make any changes or try something new, always consult with your doctor and medical team first. Chronic illness can vary from patient to patient, so it's always best to consult with your own doctor for what is best for you.
Welcome back to IBD Determined. I'm your host, Mason Harvey. I speak from the role of a patient and I have Crohn's disease.
And I'm your other host, Michelle Harvey. I am Mason's mom, and I speak in the role of a caregiver. Today's topic is going to be delayed for just a second because I just want to share what a good week I think we've had.
Share some positivity.
Yeah. And we'll get to the topic in a second, but it's just been a really cool week, I think, of getting to hand out our book to, especially to the people who, as some of you are going to find out when you read it, there's characters in the book that are based on real life people we know.
Yeah.
And so it's kind of cool to find out, who found their character or what they thought about it, to just be able to gift that and say thank you.
Yeah, once they realize it's them, they get really excited, and it's so cool to see.
Yeah,
they recognize it, and they get happy about how they affected you, because you write a whole book about that, and that means a lot.
Yeah, and I think it just kind of reiterates to them the importance of just being a friend, of being someone who takes a moment to care and to send a message of support or something. But we have had so much positive feedback with the book that it's been really cool. And so, so that's neat. And it's out available. So far, I think the bugs have been worked out, and so it's available.
Actual bugs, don't worry, the bugs are still okay.
Food, not bugs. And so it's ready to purchase. Some people want to get autographed copies, and if you reach out to us. We have any of our contact information you find, you can message us, and someone will get back to you and let you know if we are able to send one, and what that will look like. It's obviously, if you have Amazon Prime, it's a great deal because shipping is free. But if you have us send you a copy, we will give you a discount on the book, but unfortunately shipping is what shipping is.
Yeah, it's gonna be more expensive.
So we'll try our best. So it's been a good week, and this topic actually came about. It had been mentioned, somebody in response to, I believe it was, we posted about the book, and one of the parents was mentioning how cool it is that Mason has found acceptance in a way to handle this disease, and how there's concerns for when these kids turn 18. And it is a legitimate concern. And there's multiple factors, I think, that a lot of people don't understand. When you're dealing with a chronic diagnosis like IBD with your child, teen, whatever pediatric age they're at, there comes a point where they go from one day being under your care, where you help facilitate everything, to literally waking up on their 18th birthday, and that is done.
Yep, because there's not even a fade there. It's just...
No. It's just like midnight, boom,
it all of a sudden exists.
Yeah, the carriage turns back into a pumpkin.
The carriage turns back into a pumpkin.
Yeah, it's sad.
There wasn't even a transition. It just...
No, just like, there you go.
Someone just edited a pumpkin right onto the carriage and exists.
And when Mason was diagnosed, he had just turned 11. So 18 seemed really far away. I didn't even really put a thought process into, what that would look like. I just was focused on day to day, get him through whatever we need to.
Yeah.
And then slowly,
I wouldn't say slowly.
No, at our children's hospital, which I'm sure, so we're in San Diego, California. That's where he receives his care. And some of you are going to be in different states. So things may vary based on what we say or what you guys, encounter with your own care. Around the age of, I think it was probably a year after your diagnosis, around 12 or 13, maybe closer to 13.
I think it was 13. So when you were a teenager.
They started bringing in new forms, and all of a sudden it was is this the parent or caregiver filling it out? Please don't let the child do it. So there started to be little things like that. And so our hospital has a transition program to go from pediatric to adult care. And they started around that, tween teen age, and they want them to become more independent, more in charge of their own health. And learning about, things like insurance and also refilling prescriptions, simple things like that.
I think a better way to do it is just off branch instead of saying, this is for the patient, don't let the parent, do this. The kid is going to need assistance with it. And so it'd be good if it was like, this is a time for learning about how the future will be handled.
Yeah.
And so we need both you and the kid to sit down. That way, you can teach the kid what to do. And so it's not just like the kid.
I think with we were able to give feedback to our hospital and say, some of these questions were hard for him to answer, about like if you're out of network and you get your labs filled and this percentage, it was like
some 13-year-olds like,
I think he was a little older than that when they start asking that. But but I will say the good thing that comes out of that is a conversation where you as a parent even realize, oh, I should be teaching this because, I don't think the thing is I was not taught about it. I didn't have a chronic diagnosis like Mason did.
Mhm.
And so when Mason was thrown into it was kind of like the first time I really had, I mean, it's crazy to think that we had to deal with all these different insurance issues or even, deductibles and considering things like that. And so it is important to remember, like, yeah, I should start including them. But at the same time, I think Mason, you were kind of like, great, now I have all this to look forward to.
On top of schoolwork,
Uh-huh.
I have to worry about the doctors now.
So sometimes
yeah,
it's like it is important, but I think it also is a lot on your mind.
Mm-hmm.
Right.
Also considering the fact it's not like we're going once every 2 months.
Yeah.
It's once every
2
weeks. And so you're getting to fill out this paper every 2 weeks. And it's like, I just did this.
There's always papers to fill out. And then the papers, there's other things he fills out. And then depending if you've had, if you've had an ostomy, if you've had different surgeries, the questions, there's whole other forms.
Yeah.
And a lot of you may also already have patient portals. Like we have My Chart, and it's through. I think a lot of you probably have that. There's even adult ones. I have My Scripts, from my healthcare. That already is an interesting thing because once Mason hit a certain age, it was like all of a sudden they're like, you can't just access this. You have to have permission from your child.
Mm-hmm.
And it felt so strange to me because I'm like, but I'm the one still having to make these decisions and pay the insurance. And it's like, it felt strange to feel like if Mason, now of course Mason gave us permission, but if say Mason said, I don't want you to have that, now what? Like what happens if so we didn't go that route. I don't know what would happen. Luckily Mason, and any child's able to give permission for their parent to continue to help, but
know why they wouldn't.
You do have your own My Chart.
Mm-hmm.
We have a separate one that's kind of combined, but there's also services a child can consent to without needing a parent. And they also have the option to speak to their doctor alone. So some of you may already be aware, these changes happen before 18, but those aren't really what we're talking about today. Those are important to mention, but what we're talking about is that transition from where you do have, you are like their caregiver, you are the one doing everything, to suddenly it's on them. And so
great, here we go again. Insurance is like, perfect.
Yeah, now, oh my gosh, imagine those phone calls when the kid's like, I need help, and they're like, oh my gosh.
Insurance is like, great, they hit 18, they can't get help.
So yeah, I know. Well, and that's the other thing too. Like how would, like, if Mason was not informed on how and been a part of watching the insurance fights, now he'd probably be like, oh, insurance says I can't have this, okay, I don't get it, and they just would stop, and so that's the other interesting thing too, is making sure that your child is a good advocate. Mason has been raised.
Well-versed.
Yes, and that is how Mason has been raised he's been in all the conversations. We've always wanted him to be able to advocate and speak up for himself, ask his own questions, because at some point if I'm not able to do it and he's in charge, he wants to know his rights and not be told by insurance and think, oh, this is a closed deal. They say no.
So we can't afford it. So you buy, you rightfully can't take this anymore. So
right.
You're gonna need it.
And
you can't fight it either. And it's like, oh no, I can fight it.
He knows. And because sometimes you might have a GI that is not as aggressive. Our pediatric GI has been very aggressive and helpful in teaching us how to fight for what.
Blessing.
Yes. And so we've learned that. Some people have not though. So they're a little more relaxed and they don't realize what their rights are, what they can do. And so that's also very important. And
it's also good. We learn, it is also important just to, when you get your injection in the mail, or when they drop it off, it's important to check what the label says because sometimes, they'll sneak something.
Yeah. Some people
Because
have
it wasn't.
received biosimilars. They just
Yeah.
switched it out.
In the
And
past, there was
you're not supposed to do
no,
that.
they're not supposed to.
No.
But in the past, there was someone you were talking to who they got the wrong one. They weren't even told,
Mhm.
and the doctor wasn't aware, and they were like, "Why isn't this working?" And then they realized that they were getting the wrong treatment.
Well, it wasn't
Or
wrong. It was
it was
correct,
correct, but
but
it wasn't the one that
it
they were
wasn't the
supposed to
one
be
they thought
getting.
that it was a biosimilar.
Yeah.
And so good for your kids to be very
Check the
aware
labels, guys.
of these things. And and that we are aware that there are some kids out there that do want to separate from their parents in their own medical
Mm.
journeys. Some don't want to continue with their parents with it. They want to be separate. Other kids want their parents to be a very active part of it. And I think with depending on where you're at with the diagnosis, that is gonna depend. Also, some kids stay local, others go to college, they go out of state. So
Mm.
these are also things to consider, like, if they do want to go to college, but they also are like, hey, I still need help.
Yeah,
What do I
absolutely.
do? You don't want them to limit themselves on that issue as well. You want to make things as smooth as possible to give them all the
You
opportunities.
want to be able to help them and you need to be able to assist them as much as possible how they want you to.
Mm-hmm. So I'll start with asking Mason before we go into it. So as someone who is getting closer to switching, what thoughts do you have? Does it scare you? Do you feel comfortable? What do you feel about that?
I mean, because I'll allow you help. I
Hmm.
don't feel scared. The only thing that I would ever fear with converting to adult care would be that maybe, let's say, I mean, I'm not going to say that I'm going to get a bad doctor, but the doctor I
Right.
get may not be as aggressive when it comes to fighting insurance.
Hmm.
And I also fear that it's not an insurance thing, so insurance is really the only thing I'd fear, is that when you turn 18, because it's no longer pediatric, that they might become more repetitive. They wouldn't give up as easy.
Right.
That's the only thing I would really be worried about, but basically everything else, that's not really a problem for me.
I think finding a good doctor is number one in that way.
Mhm.
Like you said, you have someone you can partner with and trust, like what you currently have.
Like we've said, there's some doctors who, if the biologic just doesn't work, they go, oh, well, time for surgery instead of looking for other biologics.
Hmm.
They do that. And so, what would make me nervous is if insurance decides, you know what, they can't do this,
Hmm.
and the doctor isn't the kind that just says, all right, well, we'll fight you.
Right.
They say, oh, well, let's try surgery then.
Hmm.
Because
Or
then it's
just
permanently removing something that you never get
or
back,
just
you know?
go with the flow. Like a doctor may not have time or want to fight, and so they may just go with whatever
Yeah.
insurance says. And that's not always, again, that may not be a bad thing.
Yeah.
But
Maybe surgery would be the best for you, but
it's important to find that medical team, I think, where you feel
the most
safe.
comfortable and protected, and you can trust them that they will help you and
Yeah.
defend you.
So as a parent, that's something that we want to guide him with so he is in good hands.
Mhm.
So like if once you turn 18, do you plan to keep up with what you currently do, like for treatments? Is this something that is even because it's some kids might be thinking when I turn 18, I don't have to continue with my biologics. I can stop. I don't have to continue. I don't have to take any of this seriously. What do you say to that? Like, what do you think for
Well,
those kids?
if anyone here has never heard sarcasm before, you're about to hear it because the second I turn 18, I'm going off all my biologics and I'll be healthy forever. Now, I'm going to continue what I'm doing. It's been working. I've seen what it was like when I wasn't on biologics and I
Yeah.
felt what it was like, and it was not fun. And so while these biologics are still working and my body doesn't build up antibodies to them over time, until that happens and they stop working, I'm going to continue taking them for as long as I can because I want to get all the usage I can out of them while I still can.
Right.
So yes, of course, I'm going to continue doing what I'm doing now once I turn into an adult.
And I think I would specify, I think it's clear between us, but maybe not to listeners that that would mean whatever your doctor is recommending.
Yes.
So not necessarily like Mason's going to continue with what he's doing, even if a new doctor says this isn't good for you, and he's like, well, I'm going to keep doing this. No, it just
Yeah.
means you're going to continue with other treatment regimens, keep you
Yeah,
healthy.
healthy. Yep.
And that's important. For me as a parent, it's going to be really interesting because with Mason, he was more severe. There was a lot involved. And so it's not like a normal parent might make a few appointments a year for their kids with their regular checkups, with their dentist, with their pediatrician, things like that. For most of us in the IBD world, it involves multiple doctors, multiple appointments, labs, procedures, ordering medication, ordering biologics, contacting insurance, working with the hospital and authorizations, and then driving them because not all these kids are driving it. And
even if you can drive,
mhm,
I would still warn that even if you're adult and you're going to an infusion center,
right,
you should have somebody drive for you. And even if you're confident, you should still have somebody drive for you, because the thing is, things happen. It could react
mhm,
potentially, and if you take Benadryl to prevent a reaction, then you're going to get
yeah.
tired. And you shouldn't be driving while you're tired. It's like driving when you're about to fall asleep. And that's not safe. Not only does it put you in danger, it puts others on the road in danger. So it's definitely a good idea to bring somebody to help drive you.
I think it is. I think a lot of parents, a lot of adults who go to chemotherapy, and they usually sometimes will try to have somebody. I mean, obviously some people don't, but
There's also Ubers.
yes, it
Yeah.
is extremely important to take care of yourself and just understand that certain things may affect you differently. And so, these are all things that for us have become like routine. And Mason has been dealing with this for 6 years. And so we've been doing this. And so when Mason turns 18, it's like we're going to go from like 100 miles per hour to zero overnight. And Mason's going to suddenly go from 0 to 100 miles per hour.
Like, oh no, here we go.
So it is for me, I just want to make sure that he's receiving the best care. He's following the guidance from his doctors and he's taking all his medications and that they recommend. But it's difficult because we've always had that aspect of care where it's like, hey Mason, I know scopes are a bummer, but you got to do these, or hey, the MRI, and you have that influence that is going to keep them doing the right things. So it's difficult to take that step back and then hand that over and then hope that they make the best decision for their health with their doctor. So that
Now,
is a weird feeling, I think, for a lot of us parents.
personally, for me, I do not think that you will have to worry about that because.
No, I think with you, yeah,
Um,
no.
Now, here's the thing. If you are thinking about, should I get this scope? The doctor said I need to get scopes done, or should I just not do it because I'm an adult and I can decide not to do that? The toughest paths in life usually end up being the most rewarding, and the right path and the right choices.
Yeah.
And obviously, if you're not sure if you need scopes yet, you can say, well, while I'm doing this, we can talk about it.
Hmm.
I would like to hold off for a bit. However, if you still think that this would be the right thing to do as a doctor, I will do it. But it's important, just because something is challenging, to say, nah, I won't do it.
Right.
Because, the hardest path in life, you're not going to get anything, you're not going to get much done if you take the easy path, which not doing stuff. And in my case, not doing a scope is being blind to what the disease is doing.
Hmm.
And if the doctor wants to see that because there's something happening and they're worried, the best decision would be to probably go along with that.
I think kind of like what you said, which makes a lot of sense, which Mason has been taught to advocate for himself. So it is good to ask questions and find out, why is this needed? Is this something you're recommending immediately? Is this something you're just recommending as just like a maintenance thing? Or is this something that
Needs to be done.
needs to be done? If you are uncomfortable, because for some people, like for Mason, when he does get scopes, he flares. And so when you are doing super well, feeling really good, you have to weigh, why might I do this right now? So it's important to ask those questions. Don't just say nope and just no. Like you can,
Are you suggesting that I need this infusion, or are you telling me that this
yeah.
needs to happen?
So, I mean, it's not like, yeah, just make informed decisions. Talk to
Yeah.
your doctors and you can, of course,
And
like with Mason, you can still talk to us, but
I
first,
can only talk to your friends. And,
yeah,
and also, if you don't like what your doctor is saying, or if you disagree with what they're saying,
right.
find a second opinion. And I can't stress this enough. I've said it multiple times in this podcast, But when you're looking for a second opinion, don't go finding the doctor with the second opinion that you want to hear. Pick a doctor that has good ratings, is reliable, is responsible, is well known, and get a second opinion from them. Don't go to a doctor in an alleyway and say, "Hey, they say I need this, but I don't want it. What should I do?"
Right.
Oh yeah, thank you. I knew that was the right answer. Don't look for the answer that you're looking for. Try to find the factual evidence, responsible, reliable proof.
Like
you
what
hear.
what your current doctor does is she is very good at weighing different
Yeah.
perspectives. And so it's not like it's all or nothing. For her, it's like, well, while you could do this, I think I'll have you do this because I feel more comfortable with you doing, she thinks it through too. So again, I think that is where a lot of 18-year-olds might where things could go wrong because all of a sudden they're on their own and they're like overwhelmed. They don't, I mean, it's probably like it's a lot to do. They've got college a lot of times for the first time. They're doing, working potentially, and then having to manage your own healthcare all of a sudden. So I think that's where sometimes things go bad is not maybe because an 18-year-old is just necessarily a bad person and or just not making good decisions. I think it's a lot. And so it's easier to not make those appointments. It's easier to not order certain things because then you don't have to fight for it. And so I think it's just I think it's a lot of just not being prepared. And so I think that, what we're going to talk about next is setting you guys up so you are prepared and maybe your teen will feel better knowing they have like the backup team if they need it. And so what we're going to talk about, because sometimes like if you are even flaring, say you turn 8 and you're like, I got all this, and then you start flaring and you're feeling sick, you might need help. You might need that extra support.
You're experiencing these symptoms, which would be like tiredness, and you're running to the restroom every 15
It's gonna be hard
minutes.
to even drive to an appointment.
Yeah, you're gonna need help, and you can't just expect to be doing all this stuff by yourself.
Yeah.
You need assistance still.
And these are important to consider if your child's in another state and making sure they also have that support system so they can continue to get care and not get care because they just don't have access or they're not feeling well. One of the things is every life, like I said, life is always different. IBD it looks different for a lot of people. So when these kids are turning 18, it just makes sense to look at it a little differently. These are not just somebody who needs minimal care, just goes out into the world. They don't have to worry about doctor's appointments.
I'll be cured.
If they do need some help, there is a site I'm going to link called triagehealth.org. And what it does, it gives you a checklist. It's a detailed checklist with lots of items for teen with a chronic diagnosis like IBD, what to do when they're turning 18. So it goes over what to consider, what you might need, all the forms you might need. You might have to, you can't just call and say, oh, Mason gave me permission to call on his behalf. And it's like,
that easy, guys.
No, HIPAA is not going to let you do that. So, right now I can call and I can order his medication for him or I can call and find out a question with insurance. Pretty soon, that is not, even releasing his records. Like if I'm trying, he's going to be on our insurance. But if I try to call about a claim or do something, it's like that is his claim. So they're not going to discuss things. So, this site is very helpful. And again, this is not legal advice. I want to be very clear. This is just something we found to help.
Remember, we are not doctors. We're not scientists.
And we're not
lawyers.
No. But we're researching this to help you guys to think and to look up things. You can Google too. You can look up, ask what medical record, what do I need to access medical records, insurance claims, make calls on their behalf, those things, Google it.
And if you can't find that, remember searching is easier than ever. Google AI exists.
They'll help walk you through it. And
remember to check if Google AI finds the proper sources that you need to find and not the Wikipedia.
So check out this site if you're kind of lost, and maybe you're not lost and you think, hey, I got it all together, but maybe you don't. And so this is a very helpful thing just so you can kind of check off what you need, because I think by doing this, you're going to help your teen feel like, okay, I'm not alone all of a sudden at 18. You don't going from 17 to 18 overnight is not some magical thing like you wake up and you are suddenly super mature, you understand life, you have all the answers.
You just grow weird overnight.
Right? It's like
Hello.
all of a sudden. So a lot of times I think it is daunting, and you want kids to be excited to turn 18 to be more independent. You don't want them to be fearing like, oh gosh.
The maturity is still going like this.
Yeah.
And the
And some of us are still
just grew up like this, it just
yeah. It's important to, the whole thing to understand is you can respect their autonomy as an 18-year-old. You have to respect the fact, like, even like if whatever Mason does decide or what path he takes for treatments, we are pretty clear on everything because we've been side by side in agreement on a lot of this. But some of your kids might make different choices. As long as they're making them with their doctor and under their guidance, that's a good start. And, you have to just kind of step back and say that's all right. But the thing is, there might be a time where Mason does need help, or maybe he's had surgery and decisions need to be made. He's asleep, when he can't answer. And, where I need to know where I come in at that point as a parent, or who Mason wants to make certain decisions. That site I just told you about is going to be excellent. Yes. There's also another site that I've heard about it locally. Other parents have used it. I'm, again, this is not something I've used. I'm not like super familiar, but I've heard other parents using this for when their kids go to college. And that is called Mama Bear Legal Forms. I'm going to link that too. And they have, like they say here, they have a young adult power of attorney package, and that runs around $89. Don't forget, you may have to get these notarized. Just sitting at your kitchen table or sitting at your dining room table and having your son just sign something and say, I do this may not be enough legally. You may need it notarized. Okay. So important to ask these questions and make sure everything is done correctly. But they have things like the health power of attorney documents. They have the finance power of attorney documents, a HIPAA release and FERPA waiver. These are all important things to have.
A lot.
Yeah.
They have an assortment of choices.
And even if you don't have to use these, that's what's important to remember is you don't have to use any of these, but you can have them in place in case you need to. And that might make your child feel better knowing like you've got me. I'm all set to go. You can't do something, send me a text, give me a call, tell me what you need. I'm here. I've got this. And so they also have a free app for scanning and storing forms. And so that's not super expensive if you just want to not think about and have somebody set it up, but it's important to check these out. So that way,
Prepared.
yes. And you're not just like super intimidated, like I gotta do all this. So I think that it's just important for them to know, I guess, what their rights are as an 18-year-old. It's important for a parent to know where they're stepping back, how much their child wants them to step back. Just give them the confidence that they can do this. And you can. I mean, eventually Mason will be fine. But I know
when you're still starting out,
yeah,
as the maturity is still on an incline and the responsibilities legally just, turn into a cliff. It's still good to have that assistance while you can.
Because honestly,
but you still have to learn.
Like I can tell you, like right now with some of the things we've had to navigate for Mason, I need my husband's help. It's even difficult. Not like I need it, but it helps to have two people working on something, thinking of different angles, different things to say.
Keep in mind, he's incredibly smart. And she needs help for this stuff.
I still, well, because I figure there might be someone else might be looking at this differently, and I want to make sure I've got all angles covered. I know how hard it is for me as an adult. And so I think of an 18-year-old trying to do that. And it's nice for me to know I have help if I need it from my husband, or, I have these websites I can reference. So hopefully it's not that difficult. Hopefully as you've slowly kind of, from the point they're 14, 15, 16, 17, they've been becoming a little more involved. Hopefully they're like Mason asks his own questions. He does his own negotiations with the doctor on things. They talk about what they're going to do or whatever. He does that.
It's good to, I was going to talk about actually earlier, but it, lost its relevance. It lost its relevancy.
Okay.
Between me and my doctor, where we're discussing the importance of something that I don't want to do, like a scope or an MRI, because there was a time a few months ago, I'm sure you remember if you've been watching, where my inflammation levels were,
his calprotectin numbers
were rising. They weren't up. I wasn't feeling terrible. I wasn't feeling symptoms. I felt normal as usual, but the calprotectin levels were rising. and my doctor wanted to do scopes or get an MRI done. And so we were talking to her over Zoom because we did a what's it called?
It was a telehealth
Telehealth,
meeting.
yeah,
Yeah.
telehealth meeting to discuss it. She said, well, you can do an MRI, you can do a scope. The MRI is less,
She preferred the MRI.
she preferred the
It was
MRI, but
not as great as Ghost, but she also thought it was less risk
yeah,
on
it's less
Mason.
risky. The way I was looking at it, though, is one, the scope's obviously a lot less fun, a lot less easy, and the MRI is easier, but it's still not fun, but it's not as bad as the other one. But the thing that I was considering was if I got an MRI, the easier one, and it didn't capture everything that it needed, I would have to get both an MRI and scopes.
Yeah, he's like,
so at the end
okay.
of the day, if you want to have the most reliable decision, it would have been to just do the scopes
For that particular issue. Yeah.
issue.
Yeah. Sometimes
Yeah.
MRIs are the better, or
No,
MRIs are
this is
better.
specifically for the
Right, what
situation
she was
I'm talking
looking
about.
for.
For you, it's gonna be different. For any situation, it's gonna be different. But then I brought up, I was almost at the end of my college semester. I wasn't feeling terrible. I felt fine. I wasn't experiencing any problems. I asked her because she wasn't saying this needs to be done, and it wasn't like I was feeling terrible and I was seeing symptoms that I could tell something horrible was happening. It was like, okay, we should consider doing this, but it isn't necessary right now. And so I told her, I asked her, would it be possible to put off these scopes in the MRI once I'm done to when I'm done with the college and I have time to recover and get through whatever happens after that, and we'll see how I'm doing then. And so I please both sides. I'm getting myself some time so I can get college done with.
Right.
I don't have to worry about going into a flare mid-college because of an MRI. I don't have to worry about preparing. And then we're still considering doing it, but we'll see how I'm doing once college is done. So you have to make a deal, and eventually, because we made a deal, and in the end, the levels ended up improving, so it didn't need to be done. But it's good to not just not want to do something. It's good to set a standard or
look at your
options.
options.
Look at your options and see what needs to be done. Think critically.
Right.
Don't use
The important thing your doctor had said was that if she felt it was something that needed to happen, she would have then she would have been like, sorry, this takes precedence over, college, over all that, because health is number one. But she did tell him, I'm comfortable with this. I'm okay with it.
The thing is, I would have completely understood having to do whatever in the next week and get an MRI the very next week if I was experiencing a lot of problems. Symptoms were visible and you could feel them, and if the levels were dangerously high, they were slowly creeping up and it was trending upwards, and if it continued doing that, it would have gotten dangerous over time. But because it was slow and I wasn't experiencing any problems, she wasn't like, this is urgent. She was like, okay, well, let's see. She's comfortable with it. It'll work. But if something needs to happen, you should get that done.
Yeah. These are, it's just hopefully today, some of you listening, you might be in Mason's shoes. You might be the younger patient and facing this. If there are fears, just remember, talk to your parents about it. Talk to your doctor about it if there are concerns with this. Maybe some of you are excited because maybe you're not like a fan of where maybe there's a closer hospital when you're in adult care. Maybe you won't have to go as far. Maybe you'll have better options. So some of you might be excited for this jump too. And so no matter what, I think it's just good to be prepared, have your parents ready. So that way you can have as much or as little hands-on or hands-off activity as you want from your parents, their involvement in your medical care. So hopefully we've given you some valuable advice today to make you feel better, to give you some options.
Comfortable.
Yeah. So check that out. And it's super hot. It's like warm. So with that, I think we're gonna
Reggie's gonna
Reggie over here.
Reggie over here, he's gonna in a fan. Yeah, actually that works pretty well.
Yeah, I know. It's pretty like dusty, huh? Gosh. So hopefully, you guys are feeling well out there. You're listening right now. Hopefully things are going well. You guys are we're just about to have a weekend here. We get to go to a cool music event tomorrow night. And then on Sunday, it is Take Steps.
take steps in this warmth.
I know it's gonna be
On the bright side, it's outside next
Yeah.
to
it's
a lake.
by like a more of a bay area. It's
Okay.
in
So,
San Diego.
yeah, let's think positive. The
Yeah.
moisture that is evaporated from the sun will
We'll be by Point
naturally
Loma near or Liberty
released.
Station. It'll be nice.
Oh, yeah, and there's planes flying overhead, so
Yeah.
the wind from their thrusters will act like giant fans.
Yes.
No, it's not. Well,
Well, we'll have
we
a
could pretend.
So hopefully we'll have a good time.
We'll have a good time.
And it'll be a great walk with everybody and good to see people again we haven't seen in a while. So we're looking forward to that. So if you guys have a good weekend too, give us a follow at Team IB Determined on Instagram. And you can also, I'm going to link, I'll try to remember, I need to update last week's podcast too. The links now to purchase since everything's up and running. You can purchase a book. So if you want to get a book, you can do that. If you're watching us but wondering, hey, I just want to listen to them in my car, you can do that on stations like Spotify, iHeartRadio, Amazon Music, and Apple Podcasts.
There's
And
a link to more.
yes, lots of other
BuzzFeed.
podcast stations you can find us on. But if you're listening and say, hey, how can I'd like to
them
watch
and
them.
see that
and
they
see-
look
yeah.
shiny.
See
How can I see that? And
Oh
that
my
they're
gosh.
Reggie is a fan.
I
How
know.
can I see that? Well,
You can do
you can watch us
that.
on YouTube. There's also YouTube podcasts, but
Yeah.
YouTube videos are best for YouTube. And if you are on YouTube, make sure to give us a like and subscribe. And if you want to be notified every time we post a new video, make sure to hit that bell icon.
Yep.
And please leave comments as long as they're nice.
Yes.
Not just blatantly rude.
Yeah. Or suggestions or
Suggestions. What
Yeah.
do you want us to talk about? Is there something
what would help you.
Yeah.
Let us know how we can support you guys. That's what we're here for. So if you need, just a shoulder to lean on, if you need someone just to listen to you, if you, have something that's you would like to see us talk about, let us know. We're always here. So that's the point. That's why we do the podcast.
Everybody, because we're
help.
determined to help.
Right.
We're determined to help.
I know,
Yeah.
right? It's in the name. All right, guys. So you guys have a good weekend, a good work day, evening, morning, wherever you're starting your day or ending it. Have a good
And
one.
an MRI machine.
And, or if you're,
Oh, no.
what if I'm like,
Hey, wait,
good
you can
thing-
probably listen to our podcast. And, yeah.
we should do one of those where we just talk to
Yeah, it's
people.
So today we're going to talk bang, 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 bang.
I know, the thing is so loud. So you guys make it a good one. And we'll be back here. We'll see you in 2 weeks on the next episode. Thanks for
Bye.
listening.
Have a great week. Have 2 weeks. Yeah.
Bye-bye.
Bye.
We hope you will stick around, tune in, and reach out to us with your own journeys. We are excited to give you an inside view of what it takes to be a caregiver and what it's like to be a patient.
And most of all, we hope you'll maybe be able to apply something you hear on here that might help you in your own life. Sometimes life changes, and it's all about how you handle the journey.